have our gingival retraction techniques. So this is basically the placement of a retraction cord around the prepared margins or the cavity to actually visualize our subgingival margins so that the technician can better adapt the prosthesis that he's going to fabricate in our dental lab. So on slide 46, they're showing you the placement of a retraction cord around the prepared tooth, and then with the master impression, so dental assistant receives a syringe in a light bodied impression material and transfers the tray with medium to heavy bodied impression to the dentist. So with the light body and heavy body impressions, so someone or the assistant is going to mix the heavy body material, né? Then you're going to put it in the tray and give it off to your dentist. Then the dentist takes an impression of the cavity with just the heavy body material. And then once that has set, you then give it back to, the dentist gives it back to the assistant, who then places light body material in and around the heavy body material impression. So then the dentist takes it again, places it now in the patient's mouth with the light body material so that it oozes and flows into all the crevices and captures all the detail and the margins and the preparation that we had just done. So that's basically what happens with the master impression. So the first impression is with the heavy body, then the dentist returns the impression, you then put light body material, and then he or she retakes the impression again. So that's basically what happens with master impression. So yeah, so slide 48 just shows you a master impression where the green heavy body material was first taken with the tray, and then they then added the yellow light body material onto the heavy body material, which then the dentist used to take an impression again. Okay, so I hope that wasn't confusing. So with the try-in appointment, we are going to remove the temporary crown, which is, let's say, made out of snap, with a crown remover. I hope you guys know that instrument. And then from there, we're going to remove the excess cement that is still on our preparation after the removal of the restoration. And then from there, we're going to try in the crown that we have received from the lab. And then after trying in the crown, we're going to make any adjustments if needed, be it with aesthetics or actually with functionality. So we're going to check function or occlusion, and then we're going to check the aesthetics and then approve accordingly if necessary. If not, just leave it as it is from the lab. And then from there, once we're happy, we're going to line the inside of the crown with cement. So the dental assistant is going to be mixing cement like a resin based or resin bonded cement, and then you're going to line the inside of your crown. And then from there, the crown is placed on the tooth, and then the patient has to bite closed on a stick. So you're going to place a stick, and you're going to ask the patient to bite while the cement sets. And then once the cement has set, we're going to remove the excess cement from the margins, and then maybe just repolish if necessary after that finishing stage of the crown. Okay, so advanced chairside functions, they talk about gingival retraction. So like I said, it's very important because you ensure an impression with clear margins, so that it's very important for the technician to see your subgingival margins to ensure a proper apical seat of that fixed prosthesis. Then from there, gingival retraction, you basically retract tissue horizontally to allow room for the impression material, so that when we actually take an impression, it seeps and flows into all the crevices so that we can get an accurate description of that prepared cavity. And then from there, it displaces tissue vertically to actually expose the margin, which is what we want, because if it's accurate, then the lab will actually make an accurate job. So then there are different types of gingival retractions. So the mechanical one is the one with the retraction cord. Like I mentioned, it's either use the double technique or the single technique. So with the double technique, the dentist makes use of two different size retraction cords. So the smaller size retraction cord gets placed first around the tooth, and then from there the larger one then gets placed above. The dentist then makes sure that it's not too deep, so it's both these cords are within 1 to 3 millimeters of around or beneath our gingival margins. Okay, then normally the problem with mechanical retractions is that you have to wait a while, like 10 to 15 minutes for it to actually give you the result you're looking for. So then you will then remove the cords. You can even spray with your 3-in-1 syringe, and then thereafter then take the impression. So no drugs and chemicals are used in this process. In the mechanical process, it's left in place for 10 to 15 minutes, as I mentioned before you remove it and actually take your master impression, and then it is placed in the sulcus of heavy gingiva. Of healthy gingiva, excuse me. Then we have retraction systems. So lately there's new technology on the market. So these are retraction systems that allow for retraction that takes place quicker and is just as effective as the mechanical one. So normally with the retraction systems, they're mainly used out of silicone. So the silicone is then placed around the tooth, just like with the mechanical retraction. But instead of waiting 10 to 15 minutes, you actually wait like 1 to 2 minutes, wait for it to set, for hemorrhagia to actually arrest, and then actually clean it out with your 3-in-1 syringe before you actually take your master impression. So it's nice in that it is quicker and it arrests or controls the bleeding that you may find in the cavity at that time. So the silicone basically is placed to displace the tissue that is around our preparation, and then it prevents bleeding and creepage and seepage even around that preparation that we have done. Okay. So then we also have chemical retraction. We need to be very careful with chemical retraction because it's contraindicated with patients who have like heart conditions, diabetes, or even hypertension. Okay, so we need to have or make sure that we are cognizant of our patient's medical history before we actually go on to this type of retraction system. So we basically use an impregnated cord. So our cord is dipped into, for example, a hemostatic material or corticosteroid just to help stop the bleeding, a topical solution. So then once it is impregnated, then it is then that you place it around the tooth, so that it also helps you control bleeding and seepage in that particular area. Okay, and then there are known indications such as with diabetes and hypertension that I had mentioned before. So it is also your responsibility, oh my lord, sorry guys, it is then your responsibility as the dental assistant to make sure that your patient is still fine and they're not having an adverse reaction to the chemical retraction. Then the surgical retraction, I do not know why anybody would do this, but basically that's where the dentist removes the soft tissue that is around the prepared tooth to actually visualize the margins and then take the master impression. I find it deeply invasive. It causes a lot of bleeding. That's where some practices then have electrocryo surgery, so that you just prevent bleeding in that particular area. So yeah, an electrosurgery unit may be used, like I said, to control healing. So as it removes the tissue, it cauterizes the tissue and snips off some blood vessels, so that bleeding is controlled at the same time while you are removing the tissue. And then basically the dentist removes the tissue with the surgical knife. But if you remove it just with a surgical knife, make no mistake, there will be lots and lots of bleeding, unless then you maybe use a topical solution to actually control the bleeding, so that you can get your gingival retraction and then take your master impression as we normally do. Okay, then we're actually at the end of our lecture, guys. I hope you guys enjoyed that. If you have any questions, what do? Comment section. So please go down to your comment section, ask me questions, I'll give you answers. Please don't hesitate. I hope you enjoyed. I think that's enough for this week. We did a lot for this week, and I'll see you guys next week. Okay, enjoy and good luck with your studies.